How should patients prepare for the exam? Prior to the procedure, patients should provide their full medical history, complete a physical examination, pre-procedural diagnostic imaging tests, and discuss all possible treatment options with the healthcare provider. The procedure has moderate bleeding risk, so it requires blood tests at least 5 days before the exam. Patients should provide accurate and complete clinical information such as pregnancy, medication, allergies, previous surgeries, and bleeding history. Conventional x-rays of the spine are taken prior to the procedure to diagnose compression fractures. MRI and CT are used to determine chronicity of the fractures, presence of malignant disease, or bone marrow edema. Nuclear medicine bone scan can also be used in place of MRI. Complete blood count, coagulation study, and international normalized ratio should be within the acceptable limit. Prior to the procedure, the patient will consent by signing a consent form provided by their healthcare provider. Stop eating and drinking at least 4 hours prior to the procedure and stop non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, and other blood thinners 5 days before the exam. Patients should consult with their physician to find out which medication can still be taken. Arrive 2 hours before the scheduled appointment and notify your arrival to appropriate personnel. The patient will be given a gown to change into. Just remember the gown opens to the back. General anesthesia or conscious sedation will be given depending on the pain tolerance of the patient. The procedure takes about an hour. The patient may have an AP and lateral x-ray of the spine post-procedure and move to the recovery room to be monitored for 2 to 3 hours. Patient is usually allowed to leave on the same day, but they should arrange for someone to take them home. Patients can drink, take medication, and resume normal diet the same day. Tenderness and pain after the procedure is normal. Patients can take pain medication as prescribed to relieve the pain. It will typically go away in about a week. Avoid strenuous activity or heavy lifting for 24 hours. Keep the puncture area dry for 24 hours and avoid soaking or bathing in water until the site completely heals. If the puncture site starts to bleed, gently apply pressure with the dressing. Arrange a follow-up appointment with the doctor in 1 month. As with any interventional procedures, infection and bleeding can occur. Wrong placement of the needle during the procedure can damage nerve roots, causing radiculopathy or neurological deficit after the procedure. Injected cement can also migrate to other locations, causing pulmonary embolism or spinal stenosis. Although chances of such risks are low, patients should talk to their doctor or go to the nearest emergency if they experience bowel or bladder problems, numbness or tingling, excessive bleeding, or pain that won't go away, difficulty breathing, or fever greater than 38 degrees Celsius.